Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN. Today is a really big day in my house. Today is our dog's birthday. And in my house, everybody gets a celebration on their birthday. We were out yesterday shopping, amongst other things, but one of the big tasks to tackle was finding the perfect birthday biscuits and presents for our now 9-year-old lab boxer mix, Franklin. We affectionately call him Franklin, Dr. Zhivago Jones. Since we moved to the Jersey Shore, he's become Frankie Boy. And when my little girl was growing up, she affectionately called him Franklin Banklin. The reason that he's named Franklin is, I don't know if I've shared this with you all, but I'm a huge Peanuts fan. And for those of you that also happen to be Peanuts fans, you'll know that Franklin is the only black character on the Charlie Brown cartoon. And guess what? Franklin happens to be black. So how fitting was that? Had he been a girl, he would have been Lucy. And I previously had a wonderful chocolate lab named Linus. Rest in peace, Linus. Anyway, today we're celebrating Franklin Banklin's birthday. It will be filled with lots of dog treats, singing happy birthday. We're going to take him for a jaunt in the park so that he can run around and frolic. We'll take him on a car ride because he loves to be in the car. And he's just going to have a really amazing day. So for all of those of you who are pet owners, you know how it is. Pets are such a significant part of the family. And anyone that loves animals is all right with me. So today's topic really just tickled me pink. Of course, I'm like so ticklish anyway, but it really tickled me. I was in the office seeing like 1,000,005 patients, and any of you that see me know that I literally see like 1,000,005 patients. My schedule is always like jam-packed. But I saw one of my young patients, and I love seeing my young people because they're so cute and, energetic and have like tons of things to share. So on this particular visit, I saw one of my 22-year-olds, and she's like, Dr. Angela, I don't know how to tell you this. And I'm like, girl, just tell me. I mean, you can tell me anything. I mean, that's just me. Cool, calm, collected, really goofy. I mean, we talk about it all. And so she went on to say, I just learned to masturbate. And I thought to myself, good girl, good for you. And so I said, so tell me about it. What'd you do? What was it like? And she's like, I was touching down there. And I'm like, your vagina? And I felt that spot. And I'm like, your clitoris? And she's like, yes. And I'm like, yeah. I'm like, you got to know how to identify these things because, when you do decide to have company, so to speak, you're more than likely going to have to give them some directions and, being able to label these things and hence identify them for your partner will be a huge help. So I was like so happy for her because then the next thing out of her mouth was, I never knew what I had been missing. And of course we had a huge laugh about this because, self-exploration, learning to be comfortable with your body, actually looking at your body, you would be surprised at how many people don't look down there, don't touch down there. I'm like, it's yours, touch it. And the other really amazing thing about this is I'm like, what's great about this? And this comes up a lot when I see patients that are having any kind of sexual dysfunction or they're like, oh my gosh, sex hurts, I'm not turned on by my partner. A lot of times what I'll ask them is I'm like, well, can you achieve orgasm without your partner, i.e. by yourself? And a lot of the times the answer to that is a resounding yes. So I'm like, there it is, and sometimes folks just have to, sometimes enter into therapy, get to know each other a little bit, learn to relax, let go of some of those inhibitions. But I was really excited for her because I'm like, this is great because this is like the gift that keeps on giving. You can do this on your own. You can be happy and pleasurable and pleasure yourself on your own. And that's really important. Self-confidence, body awareness, self-love, both literally and figuratively speaking. The other thing that was so amazing about this visit is just being able to openly talk about this stuff. And women, I don't know what it is, what the taboo is. We're so afraid to talk about these things. I mean, men masturbate and touch themselves all the time. And I mean, women, it's okay to do the same. You might be surprised. And of course, this visit opened up the door to all kinds of other questions and topics. And, I just went straight Isley Brothers on her. I said, it's your thing. Do what you want to do. I can't tell you who to sock it to, but just be safe. I don't care who you sock it to, how many people you socking it to, but just be safe. And, if you're going to make it even more fun and have gadgets and toys and all of those things, just make sure that they are clean. And so, of course, this entire visit put me into the mindset. It made me think about that throwback song by the Divinyls, I Touch Myself. If you haven't heard that song, you got to pull that up. It's a classic. It's hot. And it's good. It is so good. So I'm going to just leave that at that. But what I would like to say is, it's okay. Express yourself, touch yourself, find yourself, look down there, explore, have fun. You might be surprised, just like my 22-year-old patient, what you will find or discover. For those of you that have a question or a topic that you would like discussed on the Ask Dr. Angela podcast, you know where to find me, www.askdrangela.com. That's AskDrangela.com. You can direct message me, you can email me your question, and the website, which is now up and running, and we relaunched it on Facebook Live this past weekend, is amazing. So you got to check it out. That's really the best place to find me and just see where it all is happening. I mean, that's where it's going down. So you can connect with me, via Facebook, Twitter, Instagram. You can sign up for my newsletter, which comes out weekly, which is basically an intro to the blog posts, which are both informative and, quite frankly, hilarious. You can subscribe to my YouTube channel. And then the other thing, I've been getting a lot of inquiries about my JJ hat. You can find out how to get your own JJ hat on the website. So in closing, I would just like to once again thank you so much, as always, for tuning in. Your love and support is greatly appreciated. We're getting questions. We got a question from South Africa the other day, which is amazing. So I'm going to leave you with this quote from Dr. Seuss. And again, this is coming from one of my favorite little books of inspiration from Sandy Gringas. She Went Out on a Limb. And this quote from Dr. Seuss says the following: today, you are you. That is truer than true. There is no one alive who is youer than you. Until next time, look better, feel better, be better.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.